Good morning, everyone. This is Dr.Milad Kashani with Foot and Ankle Center of Washington, and today we're going to talk about minimally invasive bunion surgery. For our presentation today, I think it's good to go over an article and discuss minimally invasive bunion surgery better. Let me share my screen really quickly. Okay, so let's talk about minimally invasive bunion surgery. It has certainly been popular recently. Uh, I have a lot of patients coming to clinic asking about minimally invasive bunion surgery. It's one of the surgeries that I offer patients who qualify for it after initial evaluation, and that's the clinical exam and imaging studies. And if we review all of those and I feel that patient is qualified for minimally invasive, that's typically one option that I offer them. So I think this article is a good starting point to talk about minimally invasive surgery. The title is Fourth Generation Minimally Invasive Hallux Valgus Surgery or Bunion Surgery. It was published in Foot and Ankle International in 2023 by Lewis et al. Uh, so this article basically starts by talking about the fact that minimally invasive bunion surgery has been around for a long time, actually. It was first described in 1991. We know it has gone through different modifications over the years. For example, from fixation by K-wires to screw fixation and different approaches. Now we have different, jigs that we do this surgery with. Um, so uh, let's talk about this article first. Let's see what minimally invasive bunion surgery is. I think this article has a great picture, which I typically use to show patients and to tell them what we are exactly trying to do. So if we have a bunion deformity like this, then typically we make a small incision, try to cut the head of first metatarsal bone, move it, towards that second metatarsal, second toe area, and then fixate it with screw. So this is a good 3D picture of it. Again, we try to cut the metatarsal head, move it closer to the second toe, and put screw fixation through it. Um, Again, if we look back, typically when surgery starts, this is again that bunion deformity, that's the bump that you see on the side. Uh, we go in, make small incision over there, cut the bone, move it closer to that second metatarsal, make sure the position is appropriate. Then we put screws, cross it with, again, two smaller incision over there. Sometimes we have to do surgery on the big toe itself as well, which we do if it becomes necessary. So basically, this article is trying to go over a few patients that they have done. This is from England, and they basically had a group of patients, one surgeon doing these surgeries in two different hospitals. And what they basically want to know is that how these patients did about after a year from surgery. They're heavily relying on patient-reported outcomes, basically patients filling up these questionnaires regarding how they're doing after surgery. Uh, what they're trying to look for is the clinical improvement in patient symptoms, which is typically pain and discomfort at that big toe joint area. The second thing that they are trying to look for is they are looking at the x-rays to see, we have certain parameters when we're looking at bunions. They want to make sure that they have seen improvement in those. So they go over again in the beginning of the article. Typically, they go over history, background of bunion surgeries, minimally invasive bunion surgeries, the benefits of it, which is, minimal incisions, uh, typically tends to have less scar tissue formation, and typically has faster recovery after surgery. So they basically go over those benefits. Again, I think it's a good article if you're thinking about getting bunion surgeries, and especially if you're thinking about getting minimally invasive bunion surgeries. Um, Again, they had a group of patients. Let's look at how many subjects or patients they had in this report. I believe it was around, yeah, they started about 50. Some people did not meet their criteria. So 47 um, different surgical cases, and they had 42 patients following up after a year. So the data is actually reported on those 42 patients. Again, this is how we typically perform the surgery: small incision, moving the bone, and then fixating with screws. So they did this on the patients. They had those patients fill up a questionnaire before regarding their pain, discomfort, and then do that after surgery in different intervals to see if they have noticed any improvement after. There's more detailed on their study design. Again, their objective was to see clinical and radiographic results. Um, but let's take a look at the results, which is what we are interested in. When we are looking at the results section, uh, when it comes to patient-reported outcome, they notice statistically significant improvement in, this is a specific questionnaire that they use for patient-reported outcomes. When it comes to pain and general health related quality of life, patient-reported outcomes, they have noticed significant improvement as well. When it comes to radiographic outcome measures, they have also noticed improvement in those. And again, these are a year out after surgery. So in general, encouraging data. And basically that is one of the articles that I've used to learn more about minimally invasive bunion surgery and to basically start performing these minimally invasive surgeries, because we always want to make sure that we have good data before we start offering patients specific treatment. Uh, One more thing, and again, this is another view of the preoperative pain. It has improved, different reports that they are looking at. And these are more radiographic data. Again, if we are looking at it, we want to make sure that on X-rays, we have also noticed improvement. But again, I always tell patients the most important thing is how that patient is feeling after surgery. X-rays might look great, and if patient's still in pain, we haven't done anything. We want to make sure that we kind of meet both of those criteria. Um, one more thing to know is talking about complications. So I just wanted to know what their complications are a year out from surgery. Um, One of them was infection. We know when it comes to foot and ankle surgeries, there are different data, but about 1 to 2% risk of infection. They had one patient with superficial infection, which was treated with antibiotics. They had some prominent screws or hardware pain, which they had to go ahead and remove those screws. Um, they had fractures which were asymptomatic, but they had one recurrence after, and this is that one patient with recurrence. So again, patient had that bunion deformity. They did the surgery on, and they noticed some recurrence afterwards. And this is the X-ray again, cutting that bone, moving that bone, fixation of that bone, and afterwards they notice recurrence. But again, the important thing is that this patient was actually pain-free and was very happy with surgery, which is what we want to see. So even if that comes back, um, as long as patient's happy and is pain-free, we have met our goal. Uh, Now, it's fair to say that minimally invasive bunion surgery is not for everyone. Again, we need to have a physical exam before surgery, making sure that you're qualified. We have to look at the x-rays and talk more about it. But this is definitely one approach that we can have to bunion. It definitely has, uh, you know, some risks when you might compare it to other bunion surgeries. This article is just out there to say, hey, this appears to be working for this small group of patients. Again, this is a small group of patients, 42 patients. It's a small group of patients. It's telling us that, hey, it is working. It has shown improvement, and the complication risk is fairly low. One big concern with minimally invasive surgery bunion, minimally invasive surgery for bunion is recurrence, which again, sometimes if they are pain-free, that's acceptable too. Uh, and again, that is one thing to keep in mind whenever you're thinking about bunion surgery. This is again a good article if you want to review. Uh, More than happy to come and see us at Foot and Ankle Center, Washington, and we can talk more about this. Just want to share this article. I found it helpful with my conversation with my patients, and I think you will find it helpful as well. Have a good one. Bye.